So thank you, Sara, for being willing to do this interview with me. And for those watching and listening, this is an opportunity to speak with a former alumni of our program who started out with a job she's really passionate about as a nurse, I think. It sure seems like it. And the coaching training, though she's not doing different work, how she's doing her work is different. And so wanted to give this opportunity for her to share more.
I really love my work and I love being a registered nurse. And so the program has really afforded me just a much greater knowledge of and practice in motivational interviewing, and then the skills of health coaching, listening, the cultural humility piece. I just love. I've worked my whole career with people from different backgrounds. Also, just even somebody coming from a suburban urban background, moving to a rural area, that I'm part Mexican American. So I'm bringing that to an area. I work with Spanish speaking people, but I also work with a lot of white farmers in my area. That's a completely different culture from which I grew up in, but I'm able to understand people better and where they're coming from and ask the right questions to develop, I think, better rapport. Hearing people's stories in a much greater depth it's also more satisfying as a practitioner to understand where people are coming from. And the health coaching has taught me sort of the theory and the practice to how you do that. And I'm finding that I'm doing that better, even when I'm not doing what would be called a standard health coaching session, because sometimes I do need to sort of do a hybrid of health education and health coaching. The sessions are just better. And then I can figure out that this individual or this particular situation might be my next visit, might be more health coaching wise, or might not. It kind of depends. It depends on the person. It depends on their access to coming into the clinic, their hours, whether I can do phone visits with them, if that will work with their work schedule. But I think it does develop a better relationship between myself as the practitioner and that individual and our clinic, because it's really demonstrates for the community health center or the mental health clinic that we stretch outside the typical boundaries of what healthcare can be, that we're respectful of people's differences, of their challenges, of their strengths. I love that about health coaching. It really pulls out people's strengths rather than only vulnerabilities. Although I think the vulnerability piece is also very important, and health coaching gets to that. But hearing the strengths from people is actually, it helps raise the level of respect in the healthcare arena, in the encounters. And then I can share some of that information with their prescribing, whether it's a physician or nurse practitioner, or I also work with chiropractor, and I work with some behavioral health therapists in my community health center. And sometimes there are details that I can share that can be helpful in the care that they're giving as well. So we can provide better care, and that individual gives us feedback sometimes through the health coaching experience that we might not have had otherwise. But I'm finding that it's raised the quality of the care that I can provide. It makes me more excited in my work. And I've learned things about some people that I've known for years, and I've done okay work with them, but I'm doing better work with them now. And I think they're doing better. And I think we can all see greater possibilities for improvement in our community health, and gets me excited that we can have some more positive changes around health in the places that I live and work.
So really exciting. I just want to thank you, Sara, for your time and for your wisdom and for taking the program. I feel honored that you were one of our, first coaching alumni, and you've just already done so much with the work, and you're already nationally board certified. So it's just really exciting to know you're out there. And thanks again for taking the time. And I hope fall is beautiful in Wisconsin.
Thank you.